Okay, I've got lots of companions today. You may hear the dog breathing over here on this side. You may hear the birds screaming in the background. So we'll see if we can get through this today without having to start and stop a lot of times with the birds. Today I thought what we would do would be to look at short-term complications of bariatric surgery. My definition of short-term complication is going to be the day after the surgery up to and including your 1 year anniversary post-operative. And I don't really know what the studies allow for that. I've seen studies that allow 30, 90, 60 days. You know, it just depends. They usually set the parameters, but I chose a year because from the perspective of someone who's had gastric bypass, a year of your life, when you balance it against the rest of your life, is short term. So one day after gastric bypass up to your 1 year anniversary mark. There's three major things to look at today. The first one is that there was recently, actually not so recent, 2007, a study done on 30-day outcomes on consecutive patients undergoing bariatric surgery procedures in 10 clinical sites in the United States. And you can always go to the description of the YouTube, and I'll put the links in so you can read these yourself. The results were venous thrombolism, percutaneous, endoscopic, or operative reintervention, or no discharge. Okay, so it was a composite with the endpoint of a 30-day major adverse outcomes. So in that 30 days, they were looking at major events that took place due to the surgical procedure itself, due to the technical or the body responding to the technical process that happened to them. And those were the three criteria. No discharge. No discharge, of course, would be death. And this was evaluated among patients undergoing first-time bariatric surgeries. There was a 0.3% to a 4.3% of participants that had at least one major adverse outcome. And that was just a general populace. There was no age criteria for this. The next article that I looked at was one that specifically looked at Medicare patients who had received the procedure. And this study was three markers: 30-day, 90-day, and 1 year post-surgical. And the rates went like this. It was a all-cause mortality among patients undergoing bariatric procedures. So whatever the reason they died, right? The rates of 30, 90, and 1 year mortality rates were 2%, 2.8%, and 4.6% respectively. Mortality rates were greater for those 65 years old and older compared with younger patients. After adjustments for sex and mortality index, the odds of death within 90 days were 5-fold greater for older Medicare beneficiaries. So the conclusion among Medicare beneficiaries, the risk of early death after bariatric surgery is considerably higher than previously suggested and associated with advancing age, male sex, and lower surgery volumes of bariatric procedures. Patients aged 65 or older had a substantially higher risk of death within the early postoperative period than the younger patients. So this is logical. When a person waits, you know, in their senior years to have this procedure, and they're doing it for diabetes, to take the stress load off their heart, to get a hold of their blood pressure, whatever their comorbidities are, they've usually had the conditions most of their life. And when you live with a medical condition for more than 20 or 30 years, actually the longer you live with it, the more damaging it is. So it's not that you've had it for 10 years and it hasn't damaged your system. It probably has. She probably has sustained some damage, but along with long-term sustained damage, they're suffering. They're also in a time when their body is already beginning to wind down. Okay, and we already know that probably their diet's not the best, or they wouldn't be in this condition. Body's starting to wind down, and it's it just cannot, a lot of them just cannot survive the assault or the stress that's placed on the body from the surgical procedure. Just general, okay, there are surgical risks that are specific to the gastric bypass procedure itself, and then there are surgical risks that are surgical risks because all surgeries are risky. And this next website's from the Mayo Clinic, and they're talking about surgical risks associated with the procedure itself, okay? So, from the Mayo Clinic, risks associated with surgical procedures can include bowel obstruction, dumping syndrome causing diarrhea, nausea, or vomiting, gallstones, hernia, low blood sugar, malnutrition, stomach perforation, ulcers, vomiting, death. And in parentheses, it does say rare past death. There are risks due for any surgery and anesthesia, which include excessive bleeding, adverse reactions to anesthesia, leak in your gastrointestinal system, abdominal hernia, chest pain, collapsed lung, constipation or diarrhea, dehydration, enlarged heart, gallstones, pain from passing a stone, inflammation of the gallbladder, or surgery to remove the gallbladder, gastrointestinal inflammation or swelling, stoma obstruction, stretching of the stomach, surgical procedures repeated, vomiting, and nausea. Okay. Reactions to medicines are also another possibility. Heart attack or stroke during or after the surgical procedure. Infections including in the gut, lungs, bladder, or kidney. Blood loss, breathing or lung problems. From another source, bariatric surgery risks associated with abdominal surgery, bleeding, complications due to anesthesia and medications, death, deep vein thrombosis, injury to stomach, esophagus, or surrounding organs, infection, pain, pneumonia, pulmonary embolism, shoulder pain, stroke, or heart attack. Okay, now there are a few things here I want to talk to you about. During my 12-month window, the people that I was associated with where I worked, there were 3 of us who had, actually 4, but she didn't really choose to be part of our group per se. Her husband was having a bariatric procedure, and they were having something that was a little bit different than us. But there were 3 of us in my office that had the same type of procedure, all within just a month span. I was the first one to go in, and the other 2 followed. Of those 3, of us 3, I should say, let me break down the complications we had. Dawn had nothing that I know of. Now, she may have since then, because I only was not quite in the office a year more after my gastric bypass. So, but at the time I left the job, she had nothing to call a complication. So that was, as far as we know, I know that was one that had her gastric bypass. Besides the typical dumping and learning how to, take care of your diet, what you can and can't eat, she really had no short-term complications. The second girl, Denise, had a revision of her stoma. She got to the point where she couldn't even swallow water, and they had to go back in and make the opening for the food to pass a little larger. They did it surgically. And then I believe that she also ended up having her gallbladder out. Our surgeon at the time of our surgery elected not to take the gallbladder out. I'm really glad he did, because I still have mine. I still have bouts that, I may have some gallbladder issues. They're never severe enough to cause me to vomit or any of the really hard things that you hear people experiencing. It was Denise who had the revision of her stoma. What happened with her is she, after surgery, she basically had started having problems immediately after they released her from the hospital, and it proceeded to the place that 3 weeks, I think, she had to, post-op, she had to go back in for another procedure, probably scarring tissue growth in that area, and she needed to have a revision on that area. Then it was maybe 6 or 7 months later that she also had a hernia, and they went in and did operation on the hernia, and at that point they did a tummy tuck on her tummy. After that, I think things leveled out. Myself, when I came out of surgery, I found out I was deathly allergic to morphine. I couldn't even open my eyes without feeling like I was going to vomit. The room would spin, and it was just horrendous. If I laid there with my eyes shut, everything was good. So I had a reaction to medicine. That's one of the possible complications from the surgical procedure. The next thing that happened was I had an injury to my trachea. When they intubated me, I don't know if they had a problem or what they had, but I had gone, after they released me from the hospital, I had gone to stay with my parents for a few days before I went home by myself. And one day after I had napped, I got up to walk across the house to sit at the kitchen table, and I couldn't get breath. I mean, it was like, I thought I was having an asthma attack maybe. I really didn't know. I just knew my airway was constricted, and we did a steam, boiled water, and I held my head over it and tried to use the steam to get my my lungs to receive oxygen. And I called my surgeon who did the gastric bypass, and he told me that we thought I had maybe some kind of infection or something, I don't know, but he said he had released me, that I needed to see my family practitioner. I called my family practitioner, and she said she couldn't do anything for me because it was on the doctor who did the surgery. So basically I was caught in a loop of nobody wanted to see me or take responsibility for what was going on with me. I ended up finally getting one of them to give me an antibiotic for the supposed infection that I thought I had. I didn't know. And I took the pill, and still for 2 weeks more at least, I could not speak. And I thought it was very curious that I would have something that caused my voice to be not there and not being able to use it for that long. I really, but I was going through this period of being post-op. I was off work. I was not in my normal routine. Things were changed. So I probably should have done something. I didn't. I just went 2 weeks without a voice and without being able to breathe well. And this was before I had returned to work. I was able to take a few weeks off from work, and I was sitting in my living room, and my youngest was sitting beside me, and hadn't been able to speak a word up until that point. I mean, I could breathe enough to try to make words, but no sound came out of my mouth. Absolutely nothing gravelly, nothing from nothing, no sound. And I was sitting on the couch with her, and I coughed, 2 coughs, and something came up in my mouth, and I said, "Give me a tissue." And she said, "Mom, you can talk." And my first thought when that happened was I could literally feel like cool air from outside my body entering into my body. So it had been long enough that change was significant in my mind to feel the cool air entering. When she passed me a paper towel and I spit up, there was a piece, that's a little big, it was like the head of a house key. There was a piece of tracheal flesh in my napkin that I had coughed up. That was my complications from gastric bypass surgery, the procedure itself. Now, above and beyond that, my surgeon had a young father. He was in his 30s, who was, if I can use the term, super morbidly obese. And he knew going into the procedure that there was a risk because his health was so poor. he may not wake up from the operating table. And he elected to undergo the procedure anyway. And his surgery was, while I was in the hospital, was by my surgeon. And indeed, he did not wake up on the operating table. He was a young man, a father of a bunch of small children, and he never woke up after. He died during surgery. The fourth person, and these are people that I don't have to go out and find to know. These are people who were attached to my life in some way, the peripheral, some way they were associated in my life. The next person that I'll tell you about is that a co-worker's sister, about 9 months after my surgery, had Roux-en-Y gastric bypass. Frankly, I don't even know what surgeon did it or where she lived. I don't even know if she was in the same state as me at the time. But her sister worked in the same office I did. And I didn't know her sister had even had the procedure until one day at work, I was told that her sister had been found dead in her house 1 month post-operative from a blood clot embolism. The other two people that I mentioned previously in my work had the band placed on, their lap band placed on the stomach, and it was a husband and wife. I understand that the husband, who was super morbidly obese, had come through the procedure well, but he was not controlling his diet well. And the wife was doing much better than he was. Now, I wanted to tell you all of that to tell you that the statistics tell you one thing. And I don't want to make it appear worse than possibly it is, okay? Because I don't want to be an alarmist. But I think in the medical field that there's a lot of holes in what's reported. Some doctors don't report, some patients don't go in. Look at me with the tracheal injury I had. I didn't know what to do. I didn't know how to fight for myself. Thank God. Probably I could have died, but I had at least made sure before I had my surgery that I went to the hospital and had a CPAP with me. So CPAP stands for continuous positive air pressure. So at night when I lay down to sleep, I have to assume that blowing into my throat and my mouth kept that flap pushed away. Otherwise, who knows, I could have passed away in my sleep. So I know from my experience that people don't always report everything, and that the statistics is not truly a good representation of what happens. It's important for you to know that things can and do go wrong. Probably they're not going to happen to you, but you can't do the surgery and say, it'll never happen to me. You just don't know. The three of us who had the same procedure by the same doctor, and this wasn't the doctor's fault. He did exquisite work. The doctor we chose, his main profession was he's a colon cancer doctor. He operates on colons. That's what he does every day. He operates on colons of people who've had cancer. He resects them, dissects them, whatever, replumbs them. And so he was excellent. His technique is excellent. But it's not just the technique. It's your level of health. It's your problems. How sick are you? These are all things that factor into. There's a saying. And it's not a very good saying, but I think it applies here. It's like, the surgery was a success, but unfortunately the patient died. That happens. The technique of the doctor is good. He's not at fault. He did the right technique. His work was beautiful. He was very, very accurate, very thorough. But depending on the health of the patient, they can die before they ever open their eyes. And if they open their eyes, you can have complications after the procedure from this procedure. Thank you for your time, and I hope that I'll see you next time. And if you want to get my videos, please subscribe. Thank you.